No, 5 seconds.
Okay, we're live. Good evening and welcome to our city council regular meeting. This is Monday, July 6th, 2020, and we are in the council chambers. As we have been doing the past few months, our public participation will be via call-in and YouTube Live. Leslie, would you please call the roll?
Yes, ma'am. Councilman Slater,
Here.
Councilman Abear,
Here.
Councilman Torgerson,
Here.
Mayor Pro Tem Dale,
Here.
and Mayor Fitch.
Here.
Okay, please stand for the invocation and pledge. Bless those present, O Lord, that the business conducted here this evening will be for the continued betterment of our city, and in keeping with thy commandments, we ask in God's name. Amen.
Amen.
I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
At this time, just a reminder that pursuant to Executive Order number 20-69, issued by the Office of Governor Ron DeSantis on March 20th, 2020, as extended by Executive Order 20-150, municipalities may conduct meetings of their governing boards without having a quorum of its members present physically at any specific location, and utilizing communications media technology such as telephonic or video conferencing as provided by section 120.545B2 Florida statute for the members of the councils who are appearing remotely and for public participation. While a quorum of council members is physically present for this meeting, along with a minimum number of key staff, we are following the governor's emergency orders and the city's emergency declarations. I'd like now to ask the city attorney to explain the procedures for public comment and participation in this meeting.
Thank you, Mayor. The following are the city's rules for utilizing communications media technology as provided by section 120.54, paragraph 5B2 Florida statutes, and as adopted by the city council on April 6, 2020. This meeting is being streamed on YouTube Live and on the city's Facebook page. The agenda and backup material in the agenda packet are posted on the city's website as usual. As set forth in the notice for this meeting, also posted last week, members of the public who wish to participate in the meeting were asked to review the agenda and submit their questions or comments on agenda items by email to the city clerk with their name and address and a reference to the agenda item on which they wish to comment. It was also explained in the notice that questions or comments on agenda items could also be mailed direct to the city clerk's attention at City of Gulf Breeze, City Hall, 1070 Shoreline Drive, Gulf Breeze, Florida 32561. The city requested that all correspondence be received by 3 p.m. Central Standard Time today, July 20th, 2020. As we go through the agenda during this meeting, the mayor will ask for public comment on an agenda item as usual. At that point in the meeting, the clerk will read the questions or comments submitted, and the mayor and council members will then respond as if the comments were being made in person. Anyone wishing to comment on an agenda item during the meeting can call into the following toll-free numbers: 1-888-585-9008, call code 186-319955. Hold and your call will be answered in turn. Comments may also be made via YouTube Live in the chat box. Any member of the public who would like to participate during the public forum at the end of the meeting should also call in to the following toll-free number. And again, that's 1-888-585-9008, call code 186-319955. And again, hold and your call will be answered in turn. Public comments may also be submitted through YouTube Live during the public forum. The standard rules also apply, with comments being limited to 3 minutes and comments on an agenda topic being applicable and relevant to that topic when it is being considered. If anyone decides to appeal any decisions, if that works, we don't need that part for this, it's not, we're not doing any quasi judicials tonight. So, I think that ends the procedures, if there are any questions, if not, we're ready to proceed.
All right, any questions? All right, we will move on. This time we'll approve the minutes from June 29th, 2020, and the special council meeting minutes. Leslie, do we have any comments or questions?
No, ma'am.
All right, do we have a motion?
Move for approval.
Thank you. Do we have a second?
Second.
We have a motion and a second. Any discussion? All in favor, say aye.
Aye.
Opposed, same sign. Thank you. Passes 5-0. All right, next we'll move on to the June 29th, 2020 council utility rates workshop meeting minutes. And again, Leslie, any comments or questions?
No, ma'am.
All right, do we have a motion?
Move for approval.
All right, do we have a second?
Second.
All right, we have a motion and a second. Any discussion, council? Hearing none, all in favor say aye.
Aye.
Opposed, same sign. Passes 5-0. Also, we will be approving the July 6th, 2020 regular council meeting minutes. Any questions?
No, ma'am.
All right. Anyone want to make a motion?
Move to approve.
All right, thank you. A second?
Second.
All right, we have a motion and a second. Any discussion?
Just a couple of typos. I don't think it's a major thing, but on page 14,
Okay.
where it says gas main relocation, is it Bear Drive or Beer Drive? That's one section says Bear, the next one says Beer.
Probably.
There's a council neighbor who lives there. Your daughter,
Like Hebrew or Herbert, right? It's like in section D, if you look at the gas main relocation for Bear Drive stormwater work, and then where it says recommendation,
Yeah,
it says Beer Drive, and then next paragraph also says Beer Drive again. That's a big deal.
Beer, like B-E-R.
Me too.
Beer? Oh.
All right, I'm assuming that was all related to Bear Drive.
Bear Drive.
Yes.
Yeah,
That's
okay,
good catch.
It's okay.
thank you. All right, anything else? Okay, hearing nothing, all in favor of the revised minutes, say aye.
Aye.
Opposed, same sign. Thank you. All right, we'll move on to resolutions, and this is the resolution number 37-2020, extending amended resolution 35-2020, I'm sorry, it's 37-2020, extending amended resolution 35-2020 as extended by resolution 36-2020, declaring state of emergency to implement protective measures related to COVID-19 and face coverings. Samantha?
Thank you, Mayor and Council. At your last meeting, when you discussed placing the resolution for consideration, updates, and ratification on future agendas, I also shared with you at that time that I would do a little bit more research on a plan moving forward for when we may want to lessen the requirement to wear a mask inside businesses. And so since then, I've talked to some area local governments, and because of the current spike, they really are not at that same point where they're thinking forward to what those benchmarks would be. And the council raised a very good point when you referred back to your pandemic plan, which is coordinated with Santa Rosa County. And the pandemic plan anticipates a prolonged event, and that there are benchmarks for when we will, increase the requirements and potential penalties associated with CDC, social distancing, and when we reduce the services that we're providing as a city, and then also when we open those services back up to our public. And so in that context, it's appropriate that if the city is requiring masks be worn inside businesses, that you also discuss how that lessening of the requirement in the future would look. But again, your other area local governments are not at the point where they have considered when they may be lessening that requirement. And so I then looked to the hospital system, and you have in front of you an update that I provided today, which just shows obviously where we are right now with the spike in COVID cases, and then also provided a little bit of a recap of my conversation with Gulf Breeze Hospital leadership. And I'll just read through that real briefly right now. But last weekend, Baptist Hospital averaged 70 COVID-19 cases per day. 10 at the Gulf Breeze Hospital, and the remaining 60 throughout the rest of the Baptist Hospital system. By comparison, in early July, Baptist had a daily average of 40 to 48 cases throughout Baptist, with 8 to 10 of those cases at Gulf Breeze Hospital. Last March to April, which is the time frame that the state of Florida declared its state of emergency, and also it was April 6th that the city council ratified its state of emergency. Baptist averaged about 15 to 20 cases daily, with 5 or less of those at Gulf Breeze Hospital. And so that kind of shares with you in context of the number of cases we have today, which is at 24. And you can compare that, backwards to last mid-March. And then below that is the total cumulative cases that we have for Santa Rosa and Escambia County, and then also broken down, by zip code. So what I would share with you is, in talking with hospital leadership, they reiterated the same points that the mayor and council had made individually when you first approved this resolution. What they said to me is that this is, not a jurisdictional issue, that they receive, patients from this greater area, and the availability of beds is obviously a critical issue for our residents, making sure that there is capacity. But this is a major thoroughfare that when you look at the numbers of Escambia County, though we don't reside in Escambia, obviously those individuals and individuals from the larger area are shopping in our stores, and this resolution relates to your businesses. And so they just, again, speaking for Gulf Breeze Hospital leadership, voice support for social distancing and for masks during this time. They also wanted to point out that last weekend was the first time that the Baptist Hospital system surpassed Sacred Heart in the number of COVID patients treated. And so they did recommend that we look back to the March, April numbers for a benchmark. They felt that was very sustainable when we had 15 to 20 cases with 5 or less cases at the hospital. Everyone was social distancing at that time. It was when everything kind of reopened that we've had this spike. So that might be where you would want to start with the benchmark. Of course, no decision needs to be made this evening, but I told you I would bring you some ideas for benchmarks, and so I wanted to share that with you. Otherwise, happy to answer any questions you may have.
The decision does need to be made to continue the resolution.
Yes, sir.
If I might just say too, given the council's prior actions and wanting to have a sunset provision in the resolution, we went ahead and built that in so that tonight's resolution, if passed, would be effective until or through August 3rd, which is your next meeting date. So if you wanted to do something between now and then, you certainly could ask for a special meeting and act to rescind or change it then. But again, this gives you the opportunity, we've already built it in, to review it again in 2 weeks when you meet next.
If I read this correctly, ever since March 23rd to April 26th, where we had travel related or assisted living related, it seems, according to this, that since then, all our cases have been community spread.
Correct.
So
Okay.
the benchmark denominator is probably overstated. If that's the situation, if those were travel and nursing home, then that number's probably overstated.
Meaning the hospital benchmark, it would be overstated?
And what I'm saying is, if you said, March and April, whatever the number was at that
Yeah.
time.
Yeah.
was here,
Right.
and that's where we should put our benchmark. It was probably overstated because of, it was travel related and nursing home were the primary two drivers of the cases. Since that time, we've experienced community spread, which was not reflected at all in those numbers.
Well, it would be reflected because those assisted living patients would still have required hospital care.
Right.
Yeah. So I don't think that those two are exclusive of each other for, that 6-week period. Probably some of them were treated at the hospital, but I wouldn't know
Not
the
in
number.
total. But-
Not in total.
But certainly statistically,
Yes.
it would be overstated.
Yes.
It's interesting though, when you talk about in the beginning, the assisted living and the travel related, well, how did the assisted living get it? It had to come from community of some sort. The community wasn't being tested at the time. It was very little testing. So we didn't really know what was in the community at the time back then as related to what we do today.
Yeah, I think the nursing home folks were much more susceptible to it.
They were more susceptible to it, but then how did they get it? They were really,
Well, what we had is, and I'll just say because thankfully the Arbors came out and did a press release and identified themselves and also the actions, that they had taken proactively. And so we don't have to guess at who it was, but that particular assisted living facility has a range of services so that some residents aren't receiving any care. And that's what happened. It was a husband and wife who weren't receiving any care. They had traveled, they came back, and then it spread through the kitchen to those who were receiving care and had not traveled. So, yeah.
so what do we currently have in proper?
We have 24 inside the city limits. And also in speaking with Gulf Breeze Hospital, I did note that Pensacola is able to report the number of residents who have received hospitalized care. That's a question that y'all have asked me in the past. And I can only, from what Department of Health reports to our emergency services, I only know if 911 needs to be called. I don't know how many of those 24, if any, have required hospitalization. And so moving forward, they're going to provide us with a number, but there is a but. It will be a resident who has needed care related to COVID anywhere throughout their system. So it won't tell us that they necessarily were at Gulf Breeze Hospital. It will be anywhere throughout the Baptist hospital system. They can't narrow it down from there, but we'll get better at our reporting, and I'll be able to at least provide to you residents who did require hospitalization.
Okay, and I'm sorry, one more question. The number of 24, is that 24 different individuals or is that 24 positive tests?
It is the number of, as of today, the number of positive cases which are still active. And what that means is it's not cumulative going back to March 23rd. As people quarantine and that address doesn't have any spread, that address comes off the system. So you may have an address that stays in the system for, 2 months, and it's because it has spread from one family member to another. But when the address comes off because no one is symptomatic or testing positive, then it's dropped off. And so we have 24 actively positive cases.
Okay, but is that 24 different individuals or is that 24 positive tests? 'Cause you could,
24.
let's say hypothetically JV tested positive
Okay.
and he gets a test and then a week later he gets tested again and he's still positive. Is that 2 tests? Or is he still only counted as one individual? That's a big, because most everybody that test positive are obviously going to be retested
I think
multiple times.
No.
You're right. I think what they're saying, an actively positive case is they're down.
And actually, most people are not testing more than once. And the reason for that is that the length of time to get the test back is now at 10 to 14 days. And so,
Really?
yes.
That's not what I'm hearing.
I talked to
Well, it's most,
2 days.
just a side note.
yes.
I talked to a vendor today that is going to make tests available through employer groups And there'll be a cost associated with it, but it is a saliva tip-based test. And so you don't have to deal with all that, and you get the results back in a day or two.
Well, that will be wonderful. As of right now, 2 weeks ago, it was reported in the paper that tests could take up to 5 to 8 days. Well, now it is at 10 to 14. And so let's just
Makes
talk
it
about,
irrelevant, really.
Yeah.
well,
They might test.
that's
I know one
exactly my point. And so what we are telling people, right now, let's say the city of Gulf Breeze is an employer. We talked about if somebody were to test positive, would we require that they test again and that test be negative before they come back to work? And the answer is no, we would not do that. Because
It's happening out there though. I know one individual from here, Gulf Breeze proper, 4 tests, 2 positives and 2 negatives. And once they tested negative once, they had to retest again twice for the second negative to be supposedly you clear to go out and mingle again.
that is not happening real time right now. That may have happened in the past when there was more availability of tests and the duration is shorter. But I have employees whose spouses or family members have tested positive. And so the employee out of precaution has tested and they aren't having any symptoms, but out of precaution, they're staying home. And I'm calling the Department of Health and we're calling the lab and we're saying this individual has now been home 10 days or more and has had no symptoms, but their spouse was symptomatic. And the response we're getting is, if you are not a first responder, the system is so overrun right now, we are only trying to speed up the results for first responders. And that has happened to us in every department. I have employees who have no symptoms. Their family member has had symptoms, and so they've stayed home. In a couple of those cases, just today, we found out that their family member who was symptomatic did not test positive. And so they have stayed home all this time out of precaution, and we'd rather that be the case than them come for 14 days until the test results come back, only to find that 2 weeks ago it was positive. So they're staying home. But that is the lag right now, real time. It is only for first responders that they are able to speed up from the 10 to 14 days that's being averaged right now. And so as more labs become available, that will improve. It was significantly improved when I tested. And when I tested, I received my result back within 48 hours. And that was 3 weeks ago. So it has changed significantly because of the spike from that time to now.
And I think, with this, my feeling too, and again, and I certainly don't like wearing a mask, but if anybody else does, it's inconvenient, it's hot. But I do think that right now with Walmart and Publix and CVS corporately requiring masks, I think one thing for us to keep our mask ordinance as it is support of them, but then also other businesses who want to do it, it gives more, I think, community substance if we have this. And since we don't have any, we don't have legal action attached to it, I think it's a good reminder for everybody to take care of their neighbor, and do the right thing. And I think too, when I go in the stores and I see the employees who are wearing these masks for 8 to 10 hours a day, I think, it doesn't hurt me to come in here for 10 minutes or 15 minutes with a mask and it may protect somebody else. Because the number that I still saw this week was that it's still 25% of the people who have it are asymptomatic or pre-symptomatic when they're diagnosed. So I still feel the same way, and particularly because we have the block.
I have something I was going to share with the group.
Okay.
I take WebMD, and they have a report from the CDC and the Assistant Secretary for Health. And he said that there are 3 things that we can do to help prevent another shutdown, which is what we're all working to do here. So first is that we know that 50, 60, 70% in some areas are traced to a single bar and secondary spread from that. So being indoors in close quarters over a long period of time is a recipe for the spread. Second, he said, in hot zones, he said, avoiding crowds in public is very, very important. We're not a hot zone, but Pensacola is. And then finally, he said, we really need 90% of the people to be wearing masks out in public when they're interacting with other people. So that's just the simple three things he said. Do. And I had it coming on in here, I thought I was going to faint. But, I'm getting more acclimated to it. And our office is, we're doing it, we're calling each other out. We're half in and half out, working remote and half at the office. And we're working ourselves to try to be more compliant with this and more sensible about taking care of the other person. So that's what we're doing.
Okay. So what is your feeling then? I guess I'm okay with leaving it as it reads, if we're gonna be reviewing it every 2 weeks and then see where we go with it. I'm also fine if we wanna set some standard, some benchmark, and then just not review it until we hit a benchmark. But I think we get good information every week, and it seems like it changes somewhat, as well as recommendations sometimes. But either way, I'm open.
I would be in favor of leaving it as it is and continue to, over these 2 weeks, maybe look deeper into the benchmarking. What I don't want to do is say, yippee, we don't have to do this anymore, because I think that is substantially what got us to this position that we're in today, is that in this area, people said, hey, this thing's over. And it's not. So I would be in favor of creating a benchmark like you suggested last time, JB. I don't know that we can create a comfort level of what that number ought to be tonight.
I think it's not gonna matter. We set a benchmark, that theory right there is gonna come through. Oh, then we need to keep it on because it's working. If we don't, we need to keep it on because it's not working. It's a lose-lose situation. I just don't like my rights being taken away and telling me that I've got to wear a mask, and you're going to tell me I have to wear a mask, and I just don't like it.
Well, that's the substance of a resolution instead of an ordinance.
I understand, but I'm just still saying. I'm still going to voice my opinion.
Right.
And that's going to be the answer no matter what. The thing goes down. It's going to be, it's working. Let's keep wearing masks. No, it's not working. Let's keep wearing masks. It's going to be that way.
It's a no-win situation.
It's a no-win situation. And then I'm going to be guilty because you're telling me I'm not being considerate. I'm not being this and that. And I don't like that. I don't like you saying that. You know what I mean? I just don't appreciate it. It's like, I don't sit there and go, I don't think you're being appreciative by wearing a mask or doing this. I like all you guys. I don't have anything against you. I'm just voicing my opinion. And mine's not the only opinion in town that is that way. And I just don't I feel like in the past 4 months, I've seen so much of our rights being taken away, and it's just ridiculous. For the type of flu that we are trying to fight here, it's not. We didn't do it for the swine flu, we didn't do it for AIDS, we didn't do it for anything else. I just don't understand why this is it a political thing? Is it just is it not, we're going to wear masks till the election's over in November? I don't know what it is, but I just feel like there's more to it than the numbers, the this, that. Otherwise, we'd been wearing masks 20 years ago, for the past 20 years to try to keep all the different flus and this and that down.
I can't speak for everybody else, but for me, it's just a matter of the science. This is an incredibly communicable disease, or infection rather, and we don't know what to do with it yet. What we do
I just don't see the death rate being crazy though,
If you're not one of them, I guess not. That's how I look at it.
Well, okay, I'm in Walgreens today. Lady's got her mask on, but yet she's buying a carton of cigarettes, to go home and smoke. Okay, well, no, you can't smoke cigarettes. You're being insensitive because you're blowing secondhand smoke into my children's face and their food. You know what I mean? Which is ridiculous to me. That it's okay to buy a carton of cigarettes, but yes, she's going to wear a mask at Walgreens while she's doing it. Where do you draw the line of telling people what they can and can't do?
I think sometimes though, they give the cigarette example is like if somebody's smoking, you can move away from them, if the smoke bothers you. And I think the thing with this is it's just, you don't know it till you get it. And so, and even, people who haven't don't know it. And so it's not like it's, I mean, I don't see it as the same as that in that regard,
Well, there's a lot of
But I see
secondhand
what
smoke
you're
cancers,
saying.
you know what I mean, that
Oh,
happen,
yeah.
Right.
There
you
are,
know, and not necessarily that somebody's blowing smoke right in their face, but everybody responds differently to it.
exactly. I just think that still with this, it's just, it's just, there's still a lot of unknowns and it is so prevalent across the whole country. And so right now, I feel like we're comparatively safe to a lot of places in terms of our numbers and that, if the advising is to do that, we should do it. But let's just have a motion on something. Does that sound fine?
Yeah, it's fine.
Okay.
I'm not gonna agree with it, but it's fine.
Yeah, I know.
You're not.
No, I know, you're surprised.
Okay.
My thoughts on it, everybody has a point, some good, not so good, whatever, depending on how you look at it, but the fact that we are, all our cases are community spread over this last few weeks. And it is, masks are not required in the unincorporated area, but I think that it's a small price to pay, I think, for what might work. One of these, I think, might help, can't hurt, and it's not that, for me personally, it's not that uncomfortable wearing a mask. Sometimes I'd rather be doing something else, but I think it's a small, simple thing that we could do that could have good results, as opposed to what could happen if we don't do it.
It's really, I think, part of a strategy, at least from my view, to say, if we can give science a chance to catch up with it, then we don't have to deal with it at all. And if we can say, let's keep it tamped down until the Gileads or Pfizers of the world come through with treatment and immunization, because that's
I
what's
don't trust them either. You know,
You're not the only one.
I don't trust them either, to be honest with you. I trust my own immune system and the way we were created to fight different germs, and I trust that more than I trust Pfizer. Come up with something.
All right, then. I make a motion that we move along with it as presented.
Do you have a second?
I'll
You
second
gonna
that.
Okay.
put a sunset date on it again, or?
It's got one in there.
It's got one. The
They did have
next
one in it for the next, okay.
All right, any further discussion? All right, all in favor, say aye.
Aye.
Whoops.
I was gonna speak, we don't have anything.
Oh.
Yeah, I was gonna let you know. Yes,
Okay, thank you very much.
Yes, ma'am.
You're all
Forgot
viewed.
that
You already know
one.
that
Thank you.
Yeah, I kind of knew how you were going to vote anyway, so the cat's not out of the bag.
All in favor, say aye.
Aye.
Aye. Opposed, say
No.
sign.
No,
You voted no?
I would have done.
Oh, you did? Okay, so 3-2. All right. Okay, so moving on. Next, we will go to resolution number 38-2020, adopting consolidated city financial policies. Samantha.
Thank you, Mayor and Council. I am going to recommend that we table this agenda item. One of the questions that was asked of your rate consultants was just for some comparative information as it relates to your debt management policy. And so I kept this on the agenda just for, you to continue to consider. But I'd like to bring that back with the framework of what other small to medium-sized communities have. And I'd hope to have that for you this evening, but the conference call where we're going to discuss that matter and some others was pushed back. And so I just asked that we table this until the next meeting.
Okay.
And then if you have any questions of them between now and then, please give it.
All right, that's fine. Any objections? All right. Okay, we will move on to the consent agenda items. Do we have a motion? Oh, do we have any public comments or questions? All right, do we have a motion regarding those?
For approval, consent agenda items out on our return.
All right, we have a motion. Do we have a second?
Second?
A second. Any discussion? All right, hearing none. All in favor, say aye.
Aye.
Opposed, same sign. Moving on to action items. All right, we are down to our amended agreement for legal services with Beggs Lane. Samantha?
Thank you. Mayor and council, as the memo details, the initial agreement was for a 2-year term, which expires July 20th. The initial agreement provides that the council may extend the agreement for another 2 years, at which time the council and Beggs and Lane might also agree to new terms. Mary Jane and I talked about how the agreement has been working at the end of the first year and again at the end of the second. And I'm a little sheepish because you will know that we have not had a typical year any of the last two. And so we've tackled items that have been an issue for a decade or more. And we outlined an immense amount of policies and procedures that we have reviewed as part of your year in review last year. And probably we could have opened individual, as I call like tabs or cases for each one of those items. But the original agreement specifies that, additional hourly billing will be provided for particular matters, and it lays out what those are, such as, litigation, grievance, arbitration, fact-finding, investigations. Obviously, all those things are outside the norm of just, Beggs and Lane's legal review on agenda matters, but it also says complex transactions. And that's where Mary Jane and I have discussed, and I have kind of argued on the side of keeping it within the retainer the last 2 years. But because we are now talking about extending for the next 2 years, understandably, Beggs and Lane's position is that we would need to increase the retainer if we're going to continue the same volume of work of the last 2 years. That was no surprise to me when I got that call, but I proposed something else instead, and that is we really are going to be approaching the first year where things will be somewhat back to normal. We're still going to be responding probably to the state operations report. After 2.5 years, we might actually get one. But those large projects such as the personnel manual, the new purchase and procurement manual, the surcharge issue with Fairpoint Regional Utility, so many of those things are well behind us. And so what I recommended to Mary Jane is just that we look at those kind of special projects, as it were, and make sure that we're opening new tabs. And that also will help me in looking at what staff can be doing more of before we're so quick to call Beggs and Lane. And I do just want to, remind you that each time a new tab is open, Mary Jane does inform the council. So you would stay, well aware of that. But that is the change. The amended agreement adds to the list of matters subject to hourly billing. I'm just quoting directly from the agreement, involving parties other than the city, including but not limited to contract negotiation and real estate matters and unique projects that do not recur on a regular basis. And I think that's very reasonable because, again, we have done so much work, but it is well behind us now. And the hourly rates do not change. So with that, I'm sure Mary Jane can answer any other questions you might have.
And I just say, I think Samantha did a good job of summarizing, where we are and what we discussed. As it turned out, the work under the retainer, because the broad nature of the services that were described in the RFP as falling under the retainer, it ended up really being almost double on average every month. Then again, some months were less than others, but I did some analysis, and over the course of the 2-year period, it was double what we had anticipated. The city went from with the prior city attorney, where the only thing under the retainer, which was a small amount that was paid on a monthly basis, was to attend the meetings. Everything else, as I understand it, fell outside the retainer and was billed hourly. We kind of went, I think you went the other direction where almost everything was under the retainer, at least it was, as it was described. We did carve out litigation, of course, and complex transactions. But the only complex transactions were, and these truly are complex, were the sale of the golf course. Those are extensive purchase agreements which require a lot of different easements and a lot of negotiations and all. And so those fell out. But then smaller transactions with other parties, like, you know, easements from time to time, things like that, which also involve other parties, you tend to suddenly think, oh, this is quick, I'll just wrap this up and send it over and we'll be done. And then you're realizing a few months down the road, you're still working on it and researching things, you know, because of just, you know, the nature of it. And so that adds up. And then, as Samantha mentioned, the special projects like personnel manual and procurement manual, which again, we've done that. We're happy we were able to do it. And one thing we don't want anyone here to feel like, oh, I can't call because I'm going to run up the bill. So we are keeping pretty much everything under the retainer, except for, again, these additional items that we've added. So, you know, going forward right now, up until now, I've done everything I've done with respect to the response on the operational audit under the retainer, but I think we're all anticipating a big chunk of work coming in the next, you know, couple months on that. So that would be an example of one we would ask to open a separate file on. But I think that way we can kind of balance it out, but still maintaining for you the same retainer amount on a monthly basis, and we will not be raising our hourly rates for you. So happy to answer any questions.
Is part of your agreement that we still get those reports from you showing,
Oh, yes.
it's just been a while since we've gotten one. I don't-
Monday, I think.
There was one that went out
Thursday.
Thursday.
Yeah, it was an attachment.
And I have
Oh, an email?
one hard copy if
Yeah.
you'd like, I can send it to you. I can get it to you.
Yeah, I like
I
that.
like the hard copy as well.
Okay, I'll be glad to.
This is the only computer I have.
Yeah, okay.
It's hard to read all that
Hard to
on
read on
this.
there. I will make sure that we get copies delivered.
You know, just showing, you know, where we are, and how much we spent and how much we spent totally, you know,
Yes,
on
it
that
does,
project,
it
you know,
does.
so that we don't end up.
Right,
No,
so for each, you know, we have a summary of the retainer, which of course is the same amount every,
Right.
you know, 3 months, it's the 30,000. And then, but I do try to give a summary of, you know, what we did in those particular months. And I do have one extra copy of it. But once again, I'll be sure you get those
Thank
going
you.
forward. You always get it as a hard copy. And then for each individual matter, for each litigation matter, for each of the transaction matters, such as the golf course, you know, an explanation of those. We also give you a summary of what's been going on with other outside counsel, such as the special counsel for the tax litigation with property appraiser. I give you a summary of what FMIT is doing and what they're covering. And then administrative type matters, sometimes the personnel matters or other things get into kind of an administrative setting, which even under the original agreement does, you know, call for opening a separate file where we're attending, you know, pension board meeting or working in a personnel dispute where there's been some, you know, kind of the formal city process has been instigated. And so, yes, we give you all of that, and we've got summaries of the dollar amounts spent, the expenses, the hours. If you have any questions or, you know, always feel free to call me. I think there was one point at which we had some that were kind of new and complex, and I sat down individually with each of you, and I'm always glad to do that. You know, if you would like, or if I feel it's called for, I'll initiate that if there are new things that I think that you would benefit from discussing. But again, my phone number's in there, and I'm always happy to answer any questions.
So I guess saying that we like it the way it is, not really good.
Working well for us.
I don't think it'll be a
No, I'm
tremendous
teasing.
change, but I think it would help to balance
I
things out.
do think it'd be helpful to make sure that if one of us were to call you, that you make sure we know if it's under retainer or the other one.
Oh, and when you call me, it's always under the retainer.
I come out of
You know,
our pay.
I
No,
don't.
no,
We don't take that out for, that is,
Yeah.
the outside the retainer is when, you know, we're dealing with the actual.
Yeah, I've learned over the years with my attorneys, that I don't ask them how they're doing or anything.
Straight to
Supposed to be
business.
one
No,
month.
I can assure you all your phone calls are retained, so.
Question for Samantha. Once this audit is finally done, if that ever happens, and we start going through it, I'm assuming we get a certain amount of time to correct anything that needs correcting, and we have a deadline or whatever. Do you foresee, as we start working through that, an uptick in legal action, or are we looking mostly at staff administrative action on that?
Well, thank you for the question, because first I do want to say we've now had 3 preliminary exit interviews, the most recent being 2 weeks ago, and I have not heard or had at any time anything suggested that the city was doing anything illegal. So what the auditors are sharing with us are recommendations for how to improve policies and procedures. But I do want to emphasize there has been not even a suggestion or a hint of anything illegal. And so moving forward, what Mary Jane what I would anticipate is that she is helping us with the analysis of, first off, are we doing things in accord with what works best for our local government? And then what would be, some recommendations if you wanted to explore them. And that is really no different than what we have been doing regardless of the state operations audit, because we already knew that it had been a decade and it was time for us to review our policies and procedures. That's why you created a charter review board. It's why you updated your personnel manual and your purchase and procurement manual. It wasn't at anybody's recommendation. I knew it from my interview when my predecessor was interviewing me for the position, and it was the very first conversation Leslie Geyer and I ever had. So these were not surprises. I don't expect there to be surprises in the audit, but I do expect that the city attorney is going to be helping the council with analyzing, what makes most sense.
Is there a way that when this is dust settles and it's all over, we can say, well, administratively, this is what the audit cost the city, this is what it cost the city as far as legal matters would be concerned, so we'd have an idea of
Yes.
how much was that time spent from Mary Jane's behalf and how much was the staff? So we can get an idea of what this actually cost the city.
Yes, and I have updated that from staff since you've last asked, and we'll have that for Mary Jane, and we'll make sure to have that to you.
That would be awesome to see.
If I could just say though, from my standpoint, up until, till now, I've done it all under the retainer, so I can kind of give you some estimates of hours, because I give you detailed
But if,
reports every month, but it hadn't cost you any more, you would, than, for my work at least. I think
Right.
we have consulted with some other attorneys on matters, but I'm sure they're.
but had you not had to deal with that, that could have been time spent on something else.
Correct, and it wouldn't have been
Yeah.
as many
And
hours.
we might not be seeing the red lines in here about the extra time.
It was one of the things that
Right.
contributed, yes.
So obviously.
One thing, I just want to.
Yeah, sure.
Doesn't really have much to do with retainer and so forth, but in reading over that last report, I got confused at how many times I saw the property appraiser come up in a different case or whatever. And there must be, what, at least 3 ongoing?
Correct, and just in laying it out for you, you first filed suit, I believe, in 2017 for the 2016 tax bill. Each year thereafter, a separate suit has to be filed in order for that tax year. And so that's why there are multiple ones. I think the first 2 years were consolidated, so there's only one case there. But then again, you approved the special counsel filing again in 2019 and then again in 2020. So I think it is laid out there several times. And there is some distinction between the first couple of cases which were consolidated in which the court has ruled, the trial court has ruled in the city's favor on summary judgment, and that is now up on appeal. The subsequent years' cases were not consolidated because during those later years, you had changed management companies, and so there was a slight change, there were some slight differences in the management contract and agreement, and the property appraiser has argued that, well, that might make a difference in the outcome. I think that, whatever the ultimate ruling is in the initial cases will hopefully give guidance and also would support, ruling in favor of the city in the subsequent cases. But again, as it stands right now, there's still an argument that there is some difference. And so that's why those are set out separately.
Do we have any idea about time?
I think it's going to be a while. They're still briefing those cases. And I don't think that the plaintiffs, or excuse me, the appellants, the property appraiser has even filed their first brief. So I think it'll be several more months.
Okay, just curious. All right, Leslie, do we have any comments or questions from the public?
Hi, no, ma'am, we do not.
All right, any further, do we have a motion from council?
Move to approve.
I'll second.
Okay, we have a motion to approve and a second. Any further discussion, questions? All right, hearing none. All in favor say aye.
Aye.
And opposed, same sign. And that passes 5-0. Thank you for all the time that you have spent. And the fact that you're still gonna be by the phone for us and not charging us extra. Okay, now we will move on to our health, dental, vision, and life insurance renewals. Samantha?
Thank you, Mayor and Council. It is that time of year, and we're happy to report that this year the city will have a 1.5% premium increase over the city's current medical rates. The increase is 4% lower than the full average. As you recall, the city is a participant in the Public Risk Management of Florida, or PRM pool, which means that when we have a claim, it isn't absorbed by our 100 full-time employees, but those claims are spread across all pool participants. And that means that we may have, a low year like this year, but when we have a high claims year, that is, leveled out with the performance of the pool overall. And so that 1.5% increase equates to a total of $15,352 increase. In the preparation of this year's budget, I just want to share with you, though, it's not a lot of money when you spread it across all participating employees. We are sharing in that cost between the employer and the employee because the annual raises are also factored into the budget, and you'll be looking at that when you have your budget workshop. And so philosophically, if the city is going to be, providing raises, then any increase should be shared between the city and the employee. And so if you want to see how that, shakes out, for even in our richest plan, it is not a increase of more than $20 a month, even for our richest plan with very little deductible. And so it continues to be a very rich plan. And so we continue to be pleased with PRM. The city for Walton Beach is also a member nearby.
Those are city hall.
And the city of Milton is, that's right. That's just, that's right. And so in addition to that, the city's ancillary benefits, which is group vision, group life, volunteer life insurance, and long-term disability insurance, is provided by Standard. And our broker of record has stated that there is a rate hold on Standard insurance coverages for the upcoming year. That is due to COVID. And so that's good. There's no increase at all this year. Of course, there might be some elasticity to that. And so we'll have to keep an eye on that for next year. So with that, I would recommend approval of the continuation of our city's group health, dental, vision, life, and disability insurance plans effective October 1.
All right, thank you. Leslie, do you have any? All right, do we have a motion?
I've got a question first.
Okay.
Just clarification on the dental, I don't see that included in the package.
I can provide it to you.
But it was a whole too.
Yes, it was
Okay,
included.
Okay, because it
Yes.
just wasn't in your write-up or in the renewal package. that was provided.
Well, it should have been,
Yeah.
but it is included.
Yeah.
Yep, thank you.
Do we have a motion?
Move to approve.
All right, do we have a second?
Second.
We have a motion and a second. Any further questions or discussion?
I have a question. So on a typical employee, what percent do they pay?
Well, we have 5 different plans.
Mm-hmm.
And so it depends on the plan, obviously, if it is a higher, deductible.
Is that in here? Is that-
It is not,
Okay.
it's very in the weeds, but I have it. I brought it for anybody
I'm just
for extra
curious.
credit if
Is
you'd
it
like to read it.
20%, 30%?
It actually graduates, and so for the plans with the higher deductible and the much, higher employee copay, the portion that they pay is smaller than in like our HMO, where they have a very little deductible.
Right.
Then the employee contribution, we've graduated and increased that every year. And the reason for that is because we do want to encourage them to go towards the less richer plans. But at this point, I also have the census, and the majority of our employees still stay with that richer HMO plan.
They do. And so
Oh, by
on
far.
a richer HMO plan, what percentage of it are they paying?
For, let's say, with the employee only, the employee is paying 7%.
7%, so that we
Yes.
pay 93% of the health insurance?
Yes,
The single or the family?
that's just the single. And then the employee with family, the employee is paying 26%, and the city pays 74%.
Deal.
It is a very good deal.
It is a good deal.
And that was included in our compensation study with Cody and Associates. So we call that the hidden paycheck, but that compensation was included when we looked at the salaries and what we pay our employees. So we try to really advertise that.
When we compare that to the private sector, it's a little disproportionate. When we compare it to other public sectors or public sector employers, that's not really way off base. We've done benchmarking in the past, and I think you did some benchmarking last year to prove that out. I think as we work toward pulling salaries toward private sector levels, at the same time, we're going to have to look at benefits and move them more to private sector status, because you can't do both. You can't have
Right.
public sector benefit levels and private sector salaries, because they're just not the same.
My only question, I was just gonna ask Todd, since he's the expert in this field, you good with this, Todd? You think?
Absolutely.
Absolutely, okay. That's-
The pool that the city is in is designed to smooth out the high highs,
Yeah.
bad years, and the low lows. If you had a really great year claims experience wise, you might not do as well in the pool as if you're on your own, but over time, it smooths things out so that they can budget and prepare for the
Right.
future.
Well, as full-time employees ourselves, so we can tap into their health insurance.
Yeah, I'd love to be able to do that.
Well, we
Yeah.
have
If you give up
that,
your salary.
I'll give up.
we
I'll
had
give
that
up my dollar.
conversation
Yeah.
with
Well,
the
you
charter
gotta-
review.
you pay
That
7
is
cents.
something
Yeah.
councils do.
What
Yeah.
kind of deductible do you get with $1 a year?
Yeah.
A big one.
No, 7% of your dollar,
7%, okay.
7% of your dollar, 7 cents.
To Samantha's point, I think this is the only city group that I'm acquainted with that doesn't include the council.
Really?
But that
We should
doesn't,
vote on that.
but that
But it's in the
doesn't,
charter.
that doesn't mean that there aren't others. It just
Yeah.
is the only one that I can think of.
That's what I'm used to,
Yeah.
and that's just one of the,
Do the council members that also get paid?
well,
Typically, yeah.
yeah, typically, but at a minimum, they are able to participate in the health benefits plan.
But we can't.
But you cannot.
Okay, so we have a motion.
Tell you what I pay you.
Yes,
And a second, okay.
I'm sure I
Any
can tell
further
you.
discussion?
No,
For the record?
we're good.
Okay, all in favor, say aye.
Aye.
Opposed, same sign. Hearing none, passes 5-0. Discussion items. Does anyone have a discussion item?
That's
All right. Any discussion items from the public?
I know you.
All right, new business from the public?
No.
All right, from the council? Samantha?
You may.
All right, public forum.
I've not received any comments, either by phone, email, or on YouTube Live, so.
All right, thank you. So it's time for council comments. All right, maybe let's start with
I think I'm
you.
good.
Changing the order. Okay.
Yeah, thank you.
Tom?
Yeah, I'd like to say something. Each year, the Optimist International holds this, they hold several contests for kids, but one of them is the oratorical contest. It's basically where kids from even the youngest age up through 18 years of age compete in this contest where the Optimist International picks the topic and you have to speak to that topic. Basically, you make a speech that is more than 4 minutes and less than 5. So, and you work your way up through several layers in this process. Here we've had one thing that's different this year is we had to have a virtual contest because of travel problems and so forth. One young man here, Mateo Morrow, just graduated from Belfast High School, entered this and in the process worked his way through several layers, like maybe 5 or 6 layers, and won the high school version, and then the regional, then the district, which is all of the North Florida district, and then regionals, which is counts several states up along the Atlantic coast, until they reached kind of the granddaddy of everything. And we go through several regions, and I believe it was 5 or 6 regions. And he wound up competing in the final 7 this past Friday. And he did not win through some problems with finances. They were unable to name one winner of those contests. Couldn't do a first, second, third, and so forth. But those of us, biased as we were, who were able to watch on the link, felt pretty strongly that he finished at least in the top 3. And so, as a part of that process, he basically was competing against the world, if you will. That's what they call it at this level. It's done in both French and English. Quite a spectacle. But he has so far won at least $5,000 on this. And in his comments after the contest, spoke highly of his city of Gulf Breeze and so forth on a world platform. So just wanted to say well done to him and to the people here who work with the kids. And this is an area, this Optimist oratorical. Every year for the last several years, Gulf Breeze has sent a finalist to some area here. This is the first one to make it this far.
That's awesome.
Yeah, that's.
Sounds like a good,
Yeah.
Gulf Breeze news story.
Yeah.
Yeah. Okay.
Send it over to Lisa.
That should do it. Todd?
I just wanted to recognize Mary Jane and her team with the outcome of the Gamble case. And the city landed where the city wanted to land, and from what I read, it sounded like the Gambles landed where they wanted to land. So that's unusual that everybody works the way it comes. Good job.
JD?
The past 2 weeks, I've spent some time kind of looking at the area where this new multipath is gonna be landing and how it's gonna be impacting different yards. And I would just challenge the rest of the council to really take a ride around town and look. There's gonna be areas where it's gonna be asphalt. If they do it from the street to the sidewalk in people's yards, and it's something, I think it's something, this is a big thing, and I know the city has wanted it. I know that our citizens have wanted it for a long time. But I really would challenge y'all to make some drives around it. And, I would like to maybe even one day, spend some time with Mr. Chamberlain, driving around and looking at, what's, maybe he can help explain to me the some of this. I was out of the country when we had some of the bigger meetings, but I would really, there's some areas that's gonna really impact a lot of vegetation. It's gonna impact a lot of, some roads is not even wide enough for a 10-foot multipath, the sidewalk, and if we're gonna do the street too, with the bike path. So I would just challenge you to ride around, look, golly, what's gonna happen to that and that and that when we have this on this side of the road, so just take a look at it.
Yeah, that's a great suggestion.
Is that something the council could do, like a little workshop where we all can get together and be taken on a tour of this is what's gonna be?
You're on there, Jane.
We still have that bus, right? We still have the
It
bus.
would be,
That would just make too much sense to be able to do that way.
As long as we carry that.
We did it before.
We talked about even doing that with the West Course, getting everyone together, but it is problematic for, Sunshine and also the new ADA compliance when we have those types of meetings. But I think that's a wonderful idea. We could schedule just a day and just individually, everyone go around with the consultant engineer and with your city project manager and do exactly what they took me through on the golf cart and showed me. I mean, just through all the maps. And I think that's a great idea.
I'd love
I
to
mean,
do that.
there's areas that's gonna be great all through here, where it backs up to the woods, no problem. But there's gonna be areas where it's gonna be.
And it does help to go
Challenging.
through with Craig what was negotiated with that property owner. How does that property owner feel if we weren't able to reach a satisfaction? Why is that? So that you better understand each issue with each property. I think that's a great idea.
Okay.
That's it. All right, congratulations to Mateo from all of us, and we're very proud of you for representing Gulf Breeze. And I think it's all tonight.
All right. Our mayor comes through.